I'm Dr. Debra Lupeika. I'm a family practice doctor who lives in Redding, California. I'm actually a family practice residency program director, and I work at Shasta Community Health Center, which is a federally qualified health center here in far northern California. My patient population is predominantly an underserved population who struggle with a lot of the social determinants of health. There's a lot of issues with transport and resources and finance. So it's been a very humbling experience to work and help them obtain the resources, medical care that they need. I love training residents, and the main reason is that they're the future of medical care. And so we need to train our residents well to become amazing doctors, because one day they're going to be taking care of us. Because I work at my federally qualified health center and serve the underserved, I thought it was very important to train residents here, because we really need doctors who take care of our underserved and marginalized patients. Redding, our area, had a pretty devastating natural disaster in 2018, which was the Carr Fire. And I remember distinctly, because we've had a lot of wildfires up in our area, but this one just seemed different. You could actually see the flames from downtown, which is incredibly scary. Literally the next morning, drove the Hope van to Shasta College, parked it, and started seeing patients with residents. We were really able to connect people with care. We had counselors to help with the mental health challenges. We had medications that we could give samples. We contacted pharmacies to get meds refilled for people because they had nothing. And it was just an amazing experience for the residents to really have that experience. And I really enjoyed going out there and working with them. The biggest advice that I would give to residents and future doctors is that pursue your passion in medicine, whatever that is, and then work's not work. You enjoy going to work because you love what you're doing. And number two is service to others. So I find working with the underserved population, my population in general, it's been such a rewarding opportunity. So whenever you can, volunteer, service to others. That's my advice. I just want to thank CMA, number one, for this award. It's very near and dear to my heart, and I am incredibly honored to receive this award. I'd also like to thank my medical society, the North Valley Medical Association, Christy and Bridget. There are people, and Dr. Danuka and Dr. Reeder and Dr. Reese, because they do a lot for our community, and I'm just honored that they chose me to nominate. I also want to thank my clinic, Shasta Community Health Center, specifically Dean Germano, our CEO, because he was really instrumental in helping me get this residency up and running, and has been just wonderful, allowing us to really expand and grow. Our program expanded during COVID, which is just phenomenal. I want to thank my residents because they just mean so much to me. It's just a joy to watch them go from kind of a scared medical student to a confident attending is just a joy. And my family, my husband, specifically Tim, he's my support. I couldn't do all this great stuff through CMA without him. And my kids, Ashley and Thomas, thank you to my kids and family. And I also want to put a shout out to Karen and Simon. They have a community called Adventures in Caring, where I started volunteering as an undergrad in Santa Barbara, seeing patients at the Santa Barbara Mission. And so they really inspired me and put compassion in my heart.